Thanks, Mark, and thanks, Jeremiah. Welcome back, and I know last week there was a lot of conversation around all of the activity around COVID and what the current administration is doing to help mitigate and support the country in its efforts of vaccine and testing. I wanted to kind of follow up with what's been going on. And so there's been more talk by Dr. Fauci. And so, and very specifically around the vaccine, we're hearing tons and more news around the vaccine. So right now, Dr. Fauci was interviewed by the editor-at-large, Stephen Levy, from The Wired. And in this conversation, it was actually kind of interesting to see to read the transcript. Dr. Fauci essentially came out and said, this outbreak will end. And he seemed to be pretty emphatic about that. And he basically came down to two things. One, that there will be a vaccine. And two, that what all of the current precautions that we're doing will need to continue without question. So based on those two statements, his sense is that this outbreak was going to end. Now, with regards to the vaccine comment, and this was a direct quote from him, is that it's likely that we will know whether we have a safe and effective vaccine somewhere around November and December. Now, that was his comment. And so, that's really, it's now October 1. November is right around the corner. And so, by all accounts, in Dr. Fauci's eye, that this seems not so much being wishful thinking. I mean, this is Dr. Fauci, head of National Institute of Allergy and Infectious Disease, which is part of the National Institute of Health, NIH. For him to actually come out and say this is pretty significant. So in this conversation, he came out and said that he's looking at, with this vaccine, that there would be 100 million doses available by the end of the year. And this would be based on high priority and high risk individuals. So 100 million doses by end of year, and that 700 million doses by the end of April for the rest of the population. So two parts to this. One is what I've been talking and speaking about in terms of the vaccine, that these companies already have in their distribution a level of vaccine that's already being developed, already being made and ready for distribution. So, but to continue that beyond that initial phase of vaccine, there would be that second phase, and that would require a much higher, a much larger supply for the general population as a whole. So that's why it sounds like they're kind of doing this in a two-step approach, which makes sense. 100 million doses up front, followed by 700 million as the second part of this. So kind of a two-phase part to this. So now another discussion that came up, I had mentioned October 26th as being an important date, and it is, because that's when the FDA is going to come together and actually sit down and review anything that is presented for emergency use. Now, what would trigger, or what would allow companies, these biotech companies, to submit their data? Now, part of this criteria is that in each biotech's trial, their phase 3 trial, there are certain benchmarks that need to be met. And you're going to hear this as being what they call events, the number of events to trigger a data dump or a submission of data information up to that point. Now, I presented this to you folks last week, but I want to give it a little more detail as to what this actually means. So Pfizer has a goal of 164 coronavirus events. That means that in their phase trial, they have recruited 30,000, and once, if they're giving the vaccine or the placebo, if there are 164 cases of coronavirus that come through one of these 30,000 individuals, it would trigger a compilation of all their data to that point for submission. This has already been predetermined. Pfizer has determined that their trigger point would be 164 cases. However, now what Pfizer has put in is that once we get to a quarter of the cases, we're going to submit. So they're going to look at their once they get to 32 cases, they are going to submit data to the FDA, not for approval, but just as a process to their approval process. They have predetermined this, and they're going to wait for their 32 infections, and then they'll present their information. Moderna, their final goal is 151 cases, and they are looking at reaching 53 cases, and then they will submit their data for kind of an oversight preview of where they stand and the safety and efficacy. AstraZeneca, 75 with an overall final goal of 150 cases. And then with Johnson & Johnson, which just entered into their phase 3, they haven't announced what that breakpoints are. But once these biotech companies and their vaccines have reached a certain number of events, that will trigger the next step. So once these vaccines trials in their phase 3 trials are going on, once they hit that, then it becomes a submission timing. Now, I had mentioned October 22nd as being one of those dates. Now, what could happen is it may take several months to get to 164 or 151 or 150. But when these companies reach that 32 or that halfway or that predetermined benchmark of events and submitting this, if the data looks so overwhelmingly impressive for establishing immunity and its safety and its efficacy, the trials may actually be stopped and approved of for its emergency use. So we could actually see it much sooner than what Dr. Fauci had mentioned, but I don't think he would give you a date unless he had some insight as to the time of when these submissions could occur. So obviously Fauci has kind of the inside track on all of this information. He sees and hears, I'm sure he's getting reports and meetings and updates all the time. So as the weeks have gone by, I see Dr. Fauci being more and more optimistic in his phrasing of his language and how he's presenting it. So I think that is people should take that as a positive thing. Now, the other thing that came out, which was kind of big news in the last 24 hours, is Moderna's CEO has come out and essentially come out and say that the level of immunity was noted to be equivalent in older individuals as it is in younger individuals. Now, that may not seem like a big point, but that is a very huge comment. The reason being is that it's been seen that older individuals' immune systems do not respond as well as a younger person's immune system. So even though you may be giving out the vaccine, actually seeing a significant increase in one's not only response, but all its ability to prevent, it goes down in older ages. So with what Moderna had come out and saying that the response in older people is equivalent to a younger person's response is really good news. So, some good headline news that's come out in the last couple of days. So now, in the same breath, the CEO of Moderna has come out and said, well, yes, the immune response is equivalent. However, they won't be ready for widespread public distribution until spring of next year. Now, the other thing that has come out is that they won't be looking for submitting for emergency authorization for the vaccine for frontline medical workers and other high risk until November 25th at the earliest. Now, I had just mentioned that from Dr. Fauci that he is looking for this approval to occur sometime in November. And while that's consistent with what Moderna statement. So I don't see that as necessarily a big surprise. But the other comment about for widespread public distribution won't be available till spring of next year. Well, that doesn't come as a big surprise either. But it's just if you look at who says what at what time, you would say, well, Moderna's, that's not good news. Well, when you listen to see what Dr. Fauci has said, and I'll pull that back up, Fauci says, well, hey, we'll be looking at this somewhere in November. Well, if that is actually true, that's actually good news. And those 100 million doses will be available for immediate distribution. Moderna says, well, we won't have widespread public distribution until next spring. Well, that's pretty consistent with what Fauci says, where 700 million doses won't be available till next year spring. So just reading between the lines, I think there is a notion here that they kind of know what's going to happen. And so they are speaking, they're speaking in a obtuse way, but in a way that if you read between the lines, it looks like they're preparing for some announcements fairly soon. So keep that in mind. This is just a quick reminder of all of the biotech companies. We know Pfizer, Moderna, AstraZeneca. We know now that Johnson & Johnson are off well into their phase 3. Novavax is just starting now in their phase 3. So all 4 of these vaccine platforms are now being in their final phase 3 trials, which is all good news. That's what we want to see. So this Operation Warp Speed, their platforms are all being met, and so this is all good news to hear. Now, another thing that has come out And if you had missed it, that the FDA has approved the emergency use approval for a new test by Abbott called the Binax Now test. And it's a little cardboard, it's a little cardboard box, not very big, maybe 3 by 3. And this test is kind of a second generation to what is currently out there right now. Abbott made kind of their first generation antigen testing for coronavirus. That was called the Abbott ID Now analyzer. And that came with a little apparatus where you do the swab, you had to put it in a special medium, plug it, and the machine runs the test for 15 minutes. Well, they've upgraded that, and now it is now a little card. You still have to swab the inner parts of your nose, and you can almost do this by yourself. Swab the inner parts of the nose, and then place it on the card. You have to put some drops on to activate the test. And so after 15 minutes, you can actually get a pretty good, you'll get a result in 15 minutes, whether it's positive or negative, kind of like a pregnancy test. So now, what's interesting about this is that the Abbott ID Now analyzer, this came out several months ago. We actually have one at our facility. Now, the downside to this, I mean, it's good that we have it. The downside to this is that the specificity of the test it was low. And I want to speak to what that actually means when I say specificity. Now, when it comes to testing, and when you want to know the results of a test, whether or not you have the disease, in this case coronavirus, or you don't have coronavirus, you want to be assured that the test that's being done gives you the most accurate, highest accuracy to whether you are positive or whether you are negative. Now, the problem with the ID analyzer before is that the specificity. So when I talk about true positives and true negatives, what that means is, as we call it, and this is really about statistics and probability. When we start looking at the sensitivity of a test, what we're talking about are the individuals who have the virus. Of all the people that have the virus, actually test positive, and that's called the sensitivity. So if you test positive, you can have a surety that the test is positive and that it actually truly is positive. And in this case, with this Abbott Binax Now test, it is 97% sensitive. That is a good thing. That is a good thing. We want that. Now, the specificity of this test is looking at the population of people without coronavirus who truly test negative. So we want to know that if you're going to be negative, that you truly are negative. This Binax test is 98% has 98% specificity. This is great. So, I mean, this is exactly what you want in a test: high sensitivity, high specificity. So if it does come back positive, you can pretty much be assured that it truly is positive. Just like it is if it's negative, that it is truly negative. The problem with the Abbott ID Now analyzer is that there have been false positives, and that's concerning. And you probably have heard this in the news, is that people will report that they are positive but later come back maybe 24 hours, 36 hours later and say, well, that was a false positive. Well, I could probably bet that what they had used was the first generation Abbott test, which gave you high false positives. And that was the concerning part, because it does impact people. People test positive, although they get a confirmation test, and then it comes back negative. So that's concerning when you have a test that actually does that. Probably they had the Abbott ID machine box, but now that this new cardboard test has come out, much better, reduces those false positives. And if you truly have it, you can be assured that it is truly positive. Just like if it was negative, you can rest assured that it was truly negative and it's not false. So this is a game changer, because what this can do is dramatically change how we address positives and certainly negatives. But I think when it comes to positive cases, we can know right away and say, hey, your test came back positive. This is what you need to do. You need to isolate, quarantine, get your family or, all of your contacts, and you can do that contact tracing pretty effectively in the moment, as opposed to what was kind of been the standard, where you get a test and you wait 3, 4, 5 days. Those 3, 4, 5 days can be a huge difference between controlling the spread versus, knowing sooner, like right immediately, versus 5 days later, and you may be out and about doing your thing and being, exposing people, thinking that you're negative when you actually truly come back positive. And this is how we kind of continue the propagation of the virus. So a lot of good stuff has come out, and regarding this test, 100 million tests are going to be distributed throughout the country. States are going to get these based on proportion of population, nursing home, assisted living, home health agencies, hospice agencies are going to get these. Historical Black colleges and universities will get a portion of this, as well as the Indian Health Service will get 300,000 of these tests. And this is going to really be a game changer for how providers and health clinics are going to be able to help manage cases. So this is a big deal, and as I'll go through the numbers here, you'll see why at this moment it's going to be important. So with that, we'll go through the numbers. So we see worldwide 33,785,000. We've had a 6.5% increase from the week prior. And in terms of fatalities, sadly, we have reached that 1 million mark worldwide. 1,010,000 fatalities, 4.2% increase from the week prior. Here in the United States, 7.2 million cases. That's a 4.2% increase, and we've actually have completed 103 million tests to date, which is remarkable. In terms of fatalities, 206,494, 2.5% from the week prior. So you can kind of get a sense of what's going on in the world, internationally, as well as here in the United States. The numbers are flat, but that's kind of a misnomer, because as I go through these numbers, you'll see that not all states are the same. We have a gradient of what the activity is going on. So when we get to Wisconsin, we now have 122,274. We've had a 15.4% increase in the number of cases, and that has steadily gone up 5 weeks in a row. And as Jeremiah had mentioned, we've had almost 3,000 cases 3,000 cases in the last 24 hours. So the number is continually going up. In terms of recovered, almost 100,000 individuals. And in terms of fatalities, 1,327, 5.4% increase from the week prior. So looking at this from an Indian health system, we know there's 573 federally recognized tribes in the country with descendants that are eligible for services at one of these federal, tribal, urban health sites. Half of the Native population utilize these health agencies. The other half uses, general public health organizations. We know populations in terms of demographics. 70% of the Native population reside off of the reservation. So programs like ourselves as an urban Indian health center become a critical access point for individuals living in urban settings off of their respective reservations. So as we look through the cases, this is the Indian Health Service posting their total numbers to date as of September 29th. And as we go through the numbers, you can see there's been some dramatic changes that have been going on. We see that in the column of September 29th, where it says the change, that is the number of new cases in the past week. You see a lot of yellow. I highlight the areas that have made the most dramatic change. You can see a lot of yellow in a lot of areas. And when you get down to the bottom, 3,849 new cases in the past week. That is the highest, that is the absolute highest number of new cases at any given time that I have been speaking of since we started this town hall. That is the highest number of cases. We've never seen this many cases at any given time. So this is pretty significant, pretty dramatic change, a huge change, almost 80% increase in just 1 week. So that is really significant, and that should start raising a lot of alarms for a lot of people. When we go to the far right, we see that there's been percent changes, 8% change overall for the entire system. But we see that there are some agencies, some areas that have much higher, much more dramatic percent changes than before. And when we look to the far right, you can see the column of trend. Essentially, everybody has shown a pretty dramatic increase, with the exception of California, with the exception of Phoenix. However, I don't know if sometimes Phoenix comes in late with their numbers, so we'll see if those truly are, if that truly is the true number. But the Portland area and the Tucson area in southern Arizona, pretty low numbers. I mean, two cases in the past week, that's almost non-existent. But overall, when you look at the entire system, it's gone up. The trend has gone up. This is the fourth week in a row the trend has gone up. So, and even here in the Bemidji area, where in the state of Wisconsin, which we're part of, the Bemidji area, it has shown an increase as well. So changes everywhere, and it's looking much more pretty dramatic for those respective areas. When we start looking at all of the cases, now that's just IHS system reporting out on numbers. I look at each state's health department numbers. So when I look at the individual states that make up Bemidji, we see that Wisconsin has over almost 1,400 cases, Minnesota 841, Michigan 590. Overall total 3,191. that is almost twice as much as the Indian health system is reporting out. So again, we kind of see that demographic change where half of the native population use the Indian health system, whereas the other half utilize the health system outside of IHS. So when we start looking at this more collectively, we see that the numbers are actually more dramatic in terms of cases. We see the same thing in the Great Plains, as well as Billings. And when we look at overall cases, we see it's pretty dramatic across the board. So what may have looked bad just within the Indian health system, it's actually worse when you add everyone outside to that overall number. So alarming, extremely alarming across the board. So looking at where we are with our respective states. To Wisconsin, as I mentioned, 122,274 cases, 15.4% increase from the week prior. So in 1 week's time, Wisconsin has seen 16,342 cases in the past week. That's over 2,300 cases per day. With the addition of the 2,800 today, that average daily number, that 7-day average of cases, is going to go up again. In Michigan, 122,687, 5.11% increase. They've only seen 6,000 cases, new cases in the past week, 867 per day. Indiana, 120,000. They've only seen, it actually should only be like 6,700 cases in the past week, but still, fairly significant. We look at Illinois, 293,000 cases, 14,000 cases in the past week, a little over 2,000 per day. And with Minnesota, just under 100,000. They've had 7,000 cases in the past week with 1,000 cases per day. So comparatively, when we look at, Michigan, Minnesota, all of these 5 states, this is really the first time in the past 6 months where Wisconsin has outpaced everybody. We have seen more cases. We have a higher 7-day average than Michigan. Michigan early on was hit pretty hard. Illinois has like 5-6 times the population of Wisconsin, and we have outpaced Illinois. Now, we've outpaced Michigan. We outpaced Minnesota. And so this is very discouraging to see such a dramatic change in 4 weeks that it really is going to be, I think everyone is going to have to take additional precautions in the next month moving forward, specifically moving about the state of Wisconsin. There may have been this sense that the rural parts of Wisconsin were going to be kind of free and clear. That's not the case anymore. So when we look at the individual states and the tribes with their respective counties, in that column of cases, that first number is the overall number of cases in that county. In parentheses is the number of new cases. So as we go down through the 12 respective tribes, we see that for the most part, the numbers, they're not significant. They've been, slightly up in some areas, down, really down in some areas. And overall, the number of total native cases is 590. But it's only 47 new cases in the past week. But however, 47 cases may not seem a lot, but for the state of Michigan, that's pretty significant. 8.6% increase from the week prior. So obviously, there's a trend that is ongoing with the tribes in Michigan. And in that far right lower corner, I have this total population, and this is an estimate But again, comparing the number of cases to the population, it just falls under 1% of all natives in Michigan have had the coronavirus. At least right now, the trend for Michigan is going up. When we look at Minnesota with the 11 respective tribes and their counties, again, we see the total number of cases and then the number of new cases in parentheses. As we go down with all of the tribes and the counties, there are some areas, some tribal areas that have shown some pretty dramatic increases. Specifically, the Red Lake, Leech Lake have shown. Prairie Island has dramatically gone up. And I put asterisks by the number of cases. The number of asterisks indicate the number of weeks. So we see Fond du Lac in its third week of an upward trend. That means every week the numbers are going up. So, you know, several tribes in Minnesota, mainly in the northern aspects, are now seeing a more dramatic impact of the cases in the rural areas. And that is the trend that I'm seeing, not only in Minnesota, but very dramatic upswings, even in Wisconsin. So, and as we look at Wisconsin with the 11 tribes and their respective counties, again, we see some pretty dramatic changes. So we have the 11 tribes with the counties that they reside in, the number of cases with the number of new cases in parentheses. The asterisk is the number of weeks of upward cases ongoing. So if we look at Shawano County and Menominee County, that is respective to the Stockbridge and Menominee tribes, consistently for 3 weeks straight, their numbers have consistently gone up. So Shawano County, which is right outside Menominee, but obviously Stockbridge, 371 cases in 1 week. That's unheard of in Shawano. I mean, that is an absolute outbreak of cases. If we look at Menominee, where part of the reservation is in Shawano, but for the most part, the Menominee County is the Menominee Reservation, we see 88 cases in Menominee. That's a lot. That is an absolutely significant outbreak, specifically over the last month, where the numbers were as low as in the 20s, 30s, and now we see the steady escalation of cases over the last couple of weeks. So Oneida resides over Outagamie in Brown County. You can see the numbers there. Overall, 14,417, almost 2,600 new cases in a week. In just this county, these two counties alone. So they have been up, increasing for the past 2 weeks. Forest County up for the last 2 weeks. Winnebago up the last 2 weeks. Bad River up. Red Cliff up. St. Croix up. Potawatomi's up. 1,381 overall cases. 227 new native cases in the state of Wisconsin, 19.7% increase from the week prior. And again, this has been a trend in Wisconsin for the past 5 weeks, where we've seen this steady incremental, huge leaps in cases. Looking at the overall population to the confirmed cases, 2.68% of the native population in Wisconsin now has had a confirmation of coronavirus. That outpaces Michigan, that outpaces Minnesota, Illinois, and so in the Bemidji area, you can consider Wisconsin as being a hotspot state, not just the county, but the entire state is a hotspot in the country. And I had just briefly looked at this. I looked at information that the New York Times have come out. Sometimes you can find your state and they can give you maps in this. Now, there's the three most populated states in the country is New York, Florida, and California. Those are the three top most populated states in the country. Wisconsin is actually 20th in terms of population. So, but in the past, essentially, we'll go by the last 7 days. So the last 7-day average, we've had 16,000 cases. The only other states that have had more cases than us is Texas and California. Those are the only two states in the country that's had more cases than Wisconsin. Wisconsin is third, and we have nowhere close the population of these other states, and we are third in the country in the past week in terms of cases. So yeah, Wisconsin is a hot spot. Illinois, we see the cases there. Compared to Wisconsin, they've maintained this number. They've always been flat in terms of their numbers, but so this isn't any new significant change in the state of Illinois. This is looking at that native population again in the state of Wisconsin. There's been one new fatality in Wisconsin, native individuals. So another aspect that I look at and follow fairly closely is looking at the age demographics in the state. Now, what's interesting is there's been some changes. So what was occurring, you can see by all these graphs and numbers, September 9th. When you look at the number, this is looking at the past 7 days on September 9th, what the number of cases were. At that time, it was 155 for 0 to 9, almost 1,200 for teenagers, almost 1,700 for the 20-year-olds, and then the older age groups, you can see the distribution. But since then, you can see the portion of cases keeps changing. So when we see September 30th, the number of new cases, where are they coming from? Well, they're coming from every age group. There's no, swing of one age group over the other. The only thing you can say is, the 20-year-olds still are outpacing everyone else. But now we're seeing that 30-year-olds, 40-year-olds, 50-year-olds, 60-year-olds, they're pretty much consistent across the board. All these age groups are equally affected, as well as the 0 to 9-year-old. So the change isn't so much just the younger population, it is now everyone. All age groups are now increasing at the same pace. That's a change. That is a change over the past month. And these numbers kind of help show how that change has been developing. Looking at age group distributions, Indiana, Michigan, all follow the same pattern as Wisconsin. All these other states, Idaho, Montana, New Mexico, pretty consistent. This is the 7-day average. As of yesterday, September 30th, we see that the 7-day average was 2,334, with the addition of today's number of over 2,800 new cases. That is a new record for the state of Wisconsin. The 7-day average is probably going to leap up over 2,500 per day with today's numbers added in now. Looking at the Milwaukee County, you would probably say, well, where are all the cases coming from? And I'll tell you this, Milwaukee County, yes, there's a higher population here, and there are cases here in Milwaukee, but it's not Milwaukee that's driving the state. But looking at this, we see that a little over 29,000 cases, 428 fatalities. And as we look at that center graph of Milwaukee County, we see that the concentrations tend to be just north and just south of the highway that splits the city in half. That's where the predominance of cases. So we're talking about the immediate north side. That is the kind of the Marquette University area. And then immediately south is we're talking about the south side of Milwaukee. But when you look at the numbers from a week ago, almost 1,800 cases. So compared that to other portions, other counties in the state, Milwaukee isn't driving. These are not high numbers here in Milwaukee. That's been pretty consistent with what Milwaukee has been doing, but it's not Milwaukee driving the state's numbers. It's other parts of the state. And so here we see the new cases per day in Milwaukee County. You know, at one point, we had July as being our high watermark of 371. And as the months have gone by, we've seen a decrease only in the last week, consistent with the state. The numbers have gone up, but certainly not to where they were back in July. Now, back in July, you could say, yeah, the city of Milwaukee was driving the overall numbers of the state, but that's not the case now. And as of 9/28, there were only 135 cases reported here in Milwaukee. Percent positive rate, Milwaukee County, as well as looking at the city of Milwaukee, you know, it's been pretty flat, anywhere from 5 to 7%. The last 7-day average as of September 28th, 7%. You know, no major dramatic increases. When we look at the city of Milwaukee, we see this tail end in September that's kind of fluctuating. We've had a low of 1.1% to as high as what was yesterday, or I'm sorry, 2 days ago, of 4.6%. So, you know, we've had these migrating numbers, but still, I would say consistently on the lower side. Looking at the 7-day average within the city of Milwaukee, we see that there's been an increase, and as of September 29th, the 7-day average was 124. When we look at Milwaukee County by zip code, we see zip code 53204, 53215, and their respective numbers. You know, Glick, the health agency here, resides in the zip code 53204. We are seeing personally, this agency has seen this increase in numbers that is consistent. You know, that is consistent what we're seeing, as well as the 215. They have seen an increase, and so that is the south side, the immediate south side of the highway, and we're smack dab in the middle of that, all of that. The number of cases, native cases here in the Milwaukee County area is now at 127. You know, certainly not to the level of other races or ethnicities, but for a native population here in Milwaukee, that is pretty significant. So, one last thing, I know I'd give you guys all kinds of numbers, but this is looking at 2 points in time, looking at the age distribution of the entire state, the demographics. That second column is the number of individuals within that age group, followed by the up-to-date numbers of that day, and then giving you percents and giving you metrics, looking at what the hospitalization rate has been, what the ICU rate has been, and the fatality rate. We just focus on the left side, these two tables. We see comparisons between September 23rd to September 30th. And as we go through each age group, yes, we've had more cases. The overall, the states, we're at a 2.2% overall for the number of cases to the population of Wisconsin. But as we look at rates of hospitalization, ICU, and fatality rates, these trends are decreasing. they're decreasing. And when you look at it closer, you see that each age group, the trend is decreasing. Not just for hospitalization rate, but also for fatalities. Even in our older generation, the fatality rate is decreasing. So in 2 points in time, within 7 days, the rates, despite increased number of cases, we're seeing a decrease in the overall rates of hospitalization and fatality. So there is a silver lining in this. The other one is being that there have been no reported fatalities of 0 to 19 years of age. And the number of fatalities in the 20-year-olds has essentially been unchanged for almost 6 weeks now. So there's been no new fatalities in the 20-year-olds in the past 5 to 6 weeks. So, which is pretty remarkable given that there's a huge influx of numbers that have been actively being reported out. Again, symptoms, you don't always have to have the classic, fever, cough, shortness of breath. We know headaches, runny nose, muscle aches, fatigue, sore throat, loss of smell, GI symptoms as nausea, vomiting, or diarrhea, or abdominal pain and cramping. All of these symptoms could be part of the prodrome of having coronavirus. So be mindful that there are other symptoms that could very well, even though you may convince yourself otherwise, they could still very well make up the symptom that you have. So we have safer at home kits. We still continue to distribute. Feel free to contact us. We are on Facebook. We have our own website. We have Circles of Strength addressing domestic and sexual assault, our youth empowerment program, helping support our Native kids. So I am actively pursuing to get this new Abbott Binox 15-minute cardboard test at our facility. This would dramatically change how we manage folks and help manage families and help reduce the spread of the virus. So with any of the signs or symptoms or definite high-risk exposure, feel free to call 414-383-9526, and we will be able to test you on the spot. So Jeremiah and Mark, how are we doing?
Hello, Dr. Ignace. Mark here. I just wanted to just explore a little bit about what we're seeing and seeing your remarks about an 80% increase for COVID-19. I think this should be and is especially concerning for tribal administrators and programs, nonprofits. We need to know this stuff, and we need to be sharing information with each other. And before I get to my questions, I'm just going to go to 5 things that I've learned in the last few weeks. One is, most recently, we've gone through Orange Shirt Day, led by our relatives in Canada, picked up here in the United States. And there's events and there's information about what Orange Shirt Day is. In basic, if you're not familiar, and most of our audience is though, but if not, it's about boarding school and survivors of the boarding school experience and kind of the historic trauma that passes from that. And it's a day to reflect on what all of that means. So there were events, educational pieces all around there. Wisconsin's seen 2 powwows last month, at least, well, one here in Wisconsin, and they're all informal. And then there was one in Chicago just recently. And then, of course, some ceremonies. And I've been able to go to some of these things, most of them, and I just kind of been sitting back and watching, because the concern is this, and it's since we've talked about this in the very beginning, is a vulnerability of tribal populations and tribal behavior, meaning there's an us to the us being Native folks, that we share our lives. When someone's having difficulties, there's a rush of support and help systems that go towards that issue. And that becomes a hub for community support. And it's awesome, but it also becomes a hub for community spread. So I'm just going to take a few moments and just shout out to tribal administrators watching this, because I think the nonprofits in Milwaukee need to have a hats off moment and say thanks to them for educating our community and keeping COVID-19 as long at bay as long as they have. So here's some things that I've learned in the last few weeks at these different events. As a coordinator, a lot of folks are putting these out: larger hand sanitizer, calling them hand sanitizing stations. At every event I've been to where these are put out onto the table, they're not used very often, mostly played with by kids. When an event puts out these kinds of smaller individual use items, a hand sanitizer that fits in a pocket, and they put multiples on tables or are made available where people are sitting in those kind of more public use areas, people are more likely to take this, use it, and take it home with them, which is exactly what you want. So that's one of the tips. And I wish we could make studies on this, but this is an evolving crisis in our community, meaning if you think hand sanitizing stations are the way to go with this, what I've noticed is these are a far better way to go, which is the smaller individual pieces. Dr. Ignace, a comment on that?
Yeah, I would agree. These 2-ounce small bottles, I mean, they're the perfect size for individuals, even within a small group. If someone was to pull this out, y'all can do immediate, hand sanitizer. So, but these smaller ounces, we have been able to commandeer a supply of hand sanitizer, and we are just cranking out these 2 ounces bottles and distributing them to everybody. Everybody who comes in, whoever wants them, this comes with that Safer at Home kit. I mean, I just ordered 10,000 2-ounce bottles. I mean, that's how much I think we will be going through this fall and winter. And I'm probably going to have to order more. They're being used that often. And so we give these out. We've given them out to special events and in support of the community. Take them, use them, individual, come back, we'll fill it up for you. I mean, we'll keep people, keep their level of prevention at a very high level.
In addition to that, what I've noticed at events is elders really like to use these. And these are these wipes. They can come in flushable or not flushable containers. When those get put out, a lot of our elders like to use those, but then it starts getting passed around. Mm-hmm. So I just wanted to finish that point by saying these two programs in Milwaukee and around Indian country use these. And if you don't have them, get them. Just because they're used more commonly. And again, that communal behavior really is something in Indian country. Here's another example, and that's singers. At a couple of powwows I went to, the singers are masked. At one powwow, there was public access to the singers where they could come in with tape recorders and listen. So we have lots of people in a very tight area listening, trying to record the singers, trying to get that good medicine for their heart and their soul and all that kind of thing. But then again, what's happening with the singers is a song or two in, the masks are coming off. Even when powwow coordinators at one started doing this, give the singers masks, awesome. Then they come off, then they start handing these out. And these are the face shields. So Dr. Ignace, can you give us kind of a 101 out there for singers that are kind of hey, POW committee is going to give you these. Then they take them off thinking this is going to help them because the POW committee or the event committee gave me these things.
Yeah, those face shields versus a face mask. I will take a face mask every day of the week and 5 times on Sunday. Those face shields don't protect you. We know that the virus gets aerosolized, it's in the air. You know, the face shields won't protect you because it's it's just a barrier to the gross distribution of a sneeze or a cough at you. It's still aerosolized, which means it can get behind the mask, which means you are breathing in the air. It doesn't protect you at all.
The fourth piece of information I'll have you weigh into is this communal food sharing that's so much a part of our culture. A lot of our events, they kind of center around that food share, and that very much, at least here in Wisconsin, is a huge part of our cultural programming and also our regular programming, meaning if we're going to have an event, you're going to have something to share with somebody. So food wise, so at one event we had the buffet table, a buffet style. People are getting food after programs like yours and participating. And I know that when I go to a public event and they're going to have this, I'm bringing my own food in. Also at the Unity Fire, we encourage people that are going to provide food that they provided when they do the ding and dash kind of stuff, where they're dropping food off for our firekeepers. They're individual bags, and the food was prepared individually at a professional place. When it comes to food sharing, what I've noticed is, and what's been helpful, but also a concern, is that it's the prepped food that are pre-wrapped. That seems to be what people are going for. But Dr. Ignace, I'd like you to weigh in on it, because when they come in, let's say this is my energy bar, and they're handing that out, it's all in a basket. Does COVID-19, can that virus live on these individual packets of prepped food like granola bars, sealed cookies, that kind of thing? And again, what's your insight into that on the food share with those individual wraps and committees and folks thinking, yeah, now we got it covered now?
Yeah, I'd be more in favor of the individual wrapped items as opposed to kind of a buffet style. With the individual wraps, what you could do is use the hand sanitizer, open. You would still, could use the outer part, the wrapping of the food as a barrier, but if you use a hand sanitizer, you could take it out of the individual wrapper, and then you would maintain a clean field between your food and your hand. I wouldn't have a problem with that. So individual wrapped items actually would be a much better deal than kind of a buffet walking through the line. I will say that if you are going to do the buffet, that you bring your own plate, not the plate that they actually give you there, but you bring your own plate from your own home with your own utensils that you've brought from home, rather than what's laid out for you to use, because you don't know where it's been. You bring your own plate, fork, spoon. You may be able to, whatever food items you want, but again, you're going to need to use that hand sanitizer before and after, and use your own utensils and your own plates. It's just, that's the cleanest separation you could possibly do.
On that, I think for tribal administrators, that's a must know too, because as I watch the food lines, no matter if the food's individually wrapped or if it's a food line where everybody's hands and they're leaning in and over the food and breathing on it and so on, close proximity to each other, what happens is those that don't bring their plates or don't bring their dishes, they're then communally using paper plates, paper cups. then they're grabbing those things. And because a lot of our folks have families, multi-generational homes, by the time you're about 20 people into a food line, or people, hey, I brought my own food, but I forgot my utensils, plates.
Yep.
There are already 100 hands that have been grabbing onto the paper cups with this, that come in the cylindrical sort of long piece. And they're also handing out paper plates to each other. And there's lots of hands that have touched that stuff. So in a moment, I'm going to grab an example of a plate that I use. But lastly, the fifth thing I wanted to share before I go to the questions, and that was mic use. At a few of the events, what we're having, and I'd like you to weigh in on this because it is a question embedded in it. At one event, they had one mic for one person, and then that's the only person doing the event. But as we know, in Indian country, you have a lot of speakers, lots of different reasons for those speakers to be using a mic. And that mic gets handed across from one person to another to another. So two different ways of dealing with that. One, people have been using wipes to wipe the top of the mic off between each use. Worse is they're just handing it from one speaker to another in group talk. And on another, they're using those foam pieces that go on top of the mic, that cover the mic, and then they'll just pop them off. And then they hand the mic to the person saying, hey, you're all good, you're safe now. And they're handing these mics off to our elders who are in general in their 60s and older. So I'd just like to hear from you about your thoughts about that mic share when people are at events, or what maybe is a better way to do it, because we are having these events. This is spreading in our community. And if it's happening, we need to know what to do differently. Dr. Ignace?
So I would say when it comes to the mic, if I think any handling of the mic, there's got to be a hand sanitizer before you touch it, after you touch it. I think if there's going to be a shared mic moment where it gets passed around, everyone who actually speaks into the mic is going to need to wear a mask. And I'm not talking about the neck gaiters or the face shields. I'm talking about wearing the surgical mask. Whether they take the top spongy foam thing off or not, you're still breathing onto, and some people spray a little bit when they talk. So, and it's the spray of when people talk that you want to prevent from getting onto the mic. So people who speak are going to have to wear a mask. You're going to need the sanitizer, sanitize before you touch the mic, after you touch the mic, pass it along. I think just to keep this one item from being exposed or contaminated, to minimize that risk. People who touch it, hand sanitizer before, hand sanitizer after, and if they're going to speak, they got to use a mask. And that would probably be the best possible option to reduce risk. Sharing a mic without a mask, I don't know, and touching it bare hand without cleaning afterwards, it's just increases your risk, and it could be prevented.
And I want to emphasize that point, because all of these places have been taking precautions for people to be safer. It's just a lack of knowledge and discussion, because people want to do the right thing. And I do hope people are paying attention to this, because we're going to be running into this, because just the communal nature of our culture. So I'd like you to weigh in on a couple of things I've also seen at gatherings, people that do bring their own plates, a wood plate. What I've seen people beginning to do is coat the inside of the wood with a polyurethane, something that can be, they're thinking is going to make it safer than just the bare wood itself.
Mm-hmm.
other folks are bringing these sort of cafeteria style, the old school BIA kind of hubcap looking sort of thing. And there's
Those are the best. Those are the best.
so if there's a mom and dad out there, they absolutely have to go to a sweat. They've listened to the program. They know they need to bring their own utensils. Which one would you suggest for them just in the washing process? Because we know these sit in the bags a lot of times.
Yeah, I'd say bring your hubcaps because they're the easiest way to clean, and sometimes you can, you know, if you're more conscious about disposable, you know, those kind of tin separator plates, those would be the best because they're reusable and you can clean them. And if you bring it from home, you know where it's been.
And then I want to just spend a special word out there to event coordinators and nonprofits that bring in singers. You know, these guys want to work for you. The women want that sing in those supportive roles. They want to do their best for you. And a lot of times all they'd see is the work of what they want to do to help people feel good, feel better. And they're not thinking and taking precautions for themselves to take care of themselves. So in turn, taking care of everybody around them. Also, we need to remember, and Dr. Ignace, I'm hoping you can address this 80% increase in rise for our population is especially dangerous because of the health disparities in our community. I was wondering if you could talk about where COVID-19 as a virus creates vulnerability in us and where we are just in general as a Native population with our own health, and why that general health pattern makes us more vulnerable when COVID-19 hits our community.
Yeah, so we know that the medical literature on coronavirus is that it targets two things. One, it targets our immune system, it targets our lungs and our vascular system, our blood, the lining of our blood. It almost takes advantage of our immune system, and then you've heard about the cytokine storm activity, this high response of our body in response to the virus. You know, there is such a thing of too much of a good thing is bad, and this is that example of our bodies of responding so significantly that it actually can be a negative effect on us. And so there are treatments out there, yes, and they are better than better than nothing. You know, they work. They help reduce hospitalization stays, as well as help save lives, but they're not absolute. So we know that high risk individuals, anybody over the age of 65, diabetes, kidney problems, liver problems, COPD. We know that we have a high population of smokers, especially in the Great Plains area. In the Bemidji area, we have a high smoking rate, high COPD rate. We have high diabetes rates, not just here, but also the entire Native population. Some areas are higher than others, but yes, diabetes. We have high kidney problem issues. And so we know that there is a disparity in number of cases per Indian versus all races combined, that, you know, diabetes, high blood pressure, cardiovascular disease, kidney problems, liver problems, lung problems, all manifest itself. And if you have all 4 of these, your risk dramatically goes up. So putting risk of health and the disparities of what Natives see currently in combination of what we know the virus can do, and knowing that a rate of increase in our Native population has dramatically gone up by 80% over the last 2 weeks, that's a bad recipe for poor outcomes for our Native communities. and I can't stress this enough, of taking this serious when it comes to protecting yourself and your family, and especially your elders and your parents. And so, you know, Mark has touched on this. We all want to kind of get back to some resemblance of our normal life before this. And I understand that. We all want that. But these being prepared to go and being very vigilant about what you touch, where you go, and how you are in terms of spatial relationship to others, you can still be an active individual outside of the home. I think you just got to be absolutely mindful of touching and where you are and where you wear your mask. And you want to reduce those point of contacts, the risk of those point of contacts as much as possible. So I know, Mark, we talked about interacting in these powwows and how to kind of mitigate reducing transmission of interacting, not just singing, but also in these communal or feast times. And so you just got to be absolute mindful of what you touch and how you are covered, protected wise.
Now, the last piece I'd like to bring to you from a cultural lens before I go to the couple questions that I have heard this last couple of weeks is I was at an event, and I don't want to upset anybody out there right now, but it does need to be talked about. There are namings that are happening. There are healings that are happening, and central to that, at least in the Great Lakes, is the use of something like this. For those of you that realize this is used for education programs that I do. So I'm not showing anybody something that's super secret or any tribal sort of violation here. And of course, that's a pipe stem. And this is what that pipe stem goes into as I'm showing it to you. So my point on this one is, at an event, I have someone in watching who has this, puts that together to do their ceremony, and then declares, as they're going to share this pipe experience with the assembled, that it's perfectly okay for them to be having this pipe brought to them and that they should smoke it, because everyone knows that COVID-19 is spread through the air, through aerosol, and that because of the sacred tobacco that's inside of here, and I'm not going to question that, but in the burning of it, they're going to be just fine. And so this starts getting shared around the circle with the assurances from the person saying, hey, it only spread through the breath. You're inhaling something that's warm and at a temperature, and go ahead and do this. So I was hoping you can comment on that, because this is a native to native conversation and we need to address this. Dr. Ignace?
So you said the key word there, sharing. Sharing in the ceremony, sharing in the blessing, sharing in the moment. Those are all fine. Those are all fine, aspects of what you just talked about. It is the sharing of the pipe. It's not so much the smoke, but your lips on the same part that gets shared amongst all of the individuals in that setting. That's where the risk comes in. So it's not so much in the smoke, that the smoke from the pipe. It is your mouth being placed on the pipe to draw from, that is being shared from one to one to one. You're basically sharing it. If there's 10 people there, you are 10 people is you. So I think the moment can be shared, and I think it would have to be in a more symbolic nature as opposed to everyone individually drawing from the pipe directly. You're on mute. Yeah.
So good, thank you. All right, that's helpful. That's why going into the show, I wanted to go through these things, because people are going into a mode, one, where there's a fatigue of listening about COVID-19, two, that now that it's in our community, the community spread is real and happening, as you said, at an incredible rate of 80%. So my last question, because I'm just going to combine what I have, just have a few moments left, is within these next couple days, within the full moon ceremonies that are happening all over the Midwest right now for our Native people, we'll have gatherings of a number of people. I was wondering if you might share a recommendation on kind of, if there's, not that we would limit it, but when we plan for events, we can have some things in mind. Do we do it inside, outside? Do we plan for, or do we limit our invitations to a certain number? How is it that we do it when we're going to be gathered together for perhaps an hour or more, and stories or conversations are going to be shared? Just kind of a general recommendations going into our full moon ceremonies for our relatives out there. Thank you.
So I think if you're looking at a physical location, let's say inside versus outside, if you're going to do any type of ceremony where there is a gathering outside of your own family, if it's your own family, I don't think there'd be I don't think there will be need for any real precautionaries if it's just your immediate family. But if you're talking about family that don't live with you, and friends, families, relatives that don't reside in your own house, I think you take it outside. You know, obviously, if the weather is tolerable where it can be outside, you still need to maintain that distance. I know you have the air, you have, distance, you have space, and that's all good, but I wouldn't rely on that as being absolute. So there would still need to be in a setting where you may be outside, wear a mask. Even, being close enough together, a cough outside, if you're in the direct line of that cough, yeah, you would want to have something to protect you before that happens, not after. So if it's going to be moved to an inside venue, I would definitely, mask, hand sanitizer, all of that would have to be, you definitely have to maintain that distance of 6 feet or more. That distance is going to become even more important. Masks are going to absolutely be important. That's, even if it's your immediate family inside, I'd say no big deal. But if you're talking about 2 degrees of separation of your immediate family, everyone has to wear masks regardless of what's going on.
So the last thing, again, I can't emphasize this enough. And again, to the administrators, even if you need to drain these to get to these,
yeah.
I cannot emphasize it enough. Do it at all of the events. The one thing that I've seen in common is the complete bypass of this and the gravitation towards these, and that these are taken home, and that's not a bad thing. Mm-hmm. So with that, we're at the end of our program. Dr. Ignace, you have the last word here, and thank you for an informative program and putting up with my energy now. It's just, we need to be talking about it, especially now. To me, this is when our nonprofits and our door-to-door workers need to go into these meetings, into stand-up things, being briefed with each other and revisiting every precaution we can, because our community is now at risk even more.
Yeah, without a doubt. And those are good words, Mark. And just looking at these numbers again, no time in COVID history here has the Indian health system been so significantly hit by cases than this past week. Never. Now, before I talk, we've talked about, we know what's happened and has occurred in Navajo, and that was kind of an isolated tribal mass outbreak. But we're not talking about just Navajo now. We're talking about every corner of the state, every tribe, every reservation, every Native community, rural, urban, are being hit hard. This is the worst I've seen it. This is the worst I've seen it for the state of Wisconsin, for Bemidji, for all areas. The Native country is being significantly impacted, especially in this past week, mainly because it is everybody. It is all areas, it is all tribes. And, with saying that, I'm still cautiously optimistic that that vaccine will come through. I am optimistic that we have therapeutics, and we have therapeutics in the pipe coming through. This is something that I do believe that we will be get through, but we all have to do our own part. We all have to mitigate the risk and reduce the transmission. And at the end of the day, we all have to protect our families. And as a result, we are protecting our own communities. And so I hope the next week is different, and we'll be getting into all of the latest updates and all the numbers again. But please don't be complacent. This is absolutely serious, continues to be serious, and we want to help. I want to help inform the Native community in reducing their risk. So, Mark and Jeremiah, until next time, we'll talk again, and everyone stay strong, stay Native strong.